Welcome to Calm Mind and Healthy Body, our channel. Managing blood pressure is crucial for overall health and well-being. High blood pressure, also known as hypertension, is a common condition that can lead to serious health issues such as heart disease, stroke, and kidney problems. Keeping blood pressure within a healthy range is essential to reduce the risk of these complications. In a recent groundbreaking study, new research has revealed a time-efficient way to lower blood pressure in just 24 minutes per week. This exciting discovery offers a convenient and effective solution for individuals looking to improve their cardiovascular health without dedicating hours to traditional exercise routines. By watching this video on lower blood pressure in 24 minutes per week, new research review, you will gain valuable insights into controlling your blood pressure levels and enhancing your overall well-being. We will delve into the study's key findings and explore the practical implications of incorporating this time-saving approach into your daily routine. Understanding the significance of managing blood pressure is essential for maintaining a healthy lifestyle. Implementing the strategies discussed in this video can reduce your risk of developing hypertension and improve your cardiovascular health and quality of life. Whether you are looking to prevent future health complications or optimize your well-being, lowering your blood pressure in a time-efficient manner can profoundly impact your overall health. Join us as we uncover the latest research on lowering blood pressure in just 24 minutes per week and discover how to achieve significant health benefits with minimal time investment. Stay tuned to learn more about this innovative approach and take the first step towards better cardiovascular health today. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. The most overlooked causes of hypertension, high blood pressure. Hypertension is a common health condition affecting millions worldwide. While factors such as diet, exercise, and age are well-known contributors to elevated blood pressure levels, several lesser-known causes often go unnoticed. By understanding these overlooked factors, individuals can take proactive steps to manage their blood pressure and reduce their risk of developing hypertension-related complications. One of the key overlooked causes of high blood pressure is lifestyle habits. Poor dietary choices, such as high sodium, saturated fats, and processed foods, can significantly impact blood pressure levels. Additionally, chronic stress and lack of physical activity can also contribute to hypertension. Adopting a healthy lifestyle with a balanced diet, regular exercise, and stress management techniques can help individuals lower their blood pressure and improve their overall health. Genetics and family history play a crucial role in determining an individual's risk of developing hypertension. While lifestyle factors are essential, genetic predisposition can influence blood pressure levels. Individuals with a family history of high blood pressure are at a higher risk of developing the condition themselves. By understanding the role of genetics in hypertension, individuals can work with their healthcare providers to create personalized treatment plans that address genetic and lifestyle factors. Identifying and addressing the most overlooked causes of high blood pressure is essential for effectively managing the condition and reducing the risk of complications. Individuals can make informed decisions about their health and well-being by taking a holistic approach to blood pressure management that considers lifestyle habits, genetics, and family history. By raising awareness about these lesser-known factors contributing to hypertension, we can empower individuals to take control of their blood pressure levels and lead healthier, happier lives. The relationship between dementia and blood pressure, heart disease. The connection between blood pressure, dementia, and heart disease is complex and significant, underscored by the importance of managing blood pressure for overall brain and heart health. High blood pressure, also known as hypertension, can have detrimental effects on cognitive function and cardiovascular health, making it a crucial factor to consider in the prevention of dementia and heart-related issues. High blood pressure is a known risk factor for dementia, as it can lead to damage in the blood vessels of the brain and increase the risk of cognitive decline. Individuals with untreated hypertension are more likely to develop conditions such as Alzheimer's disease and vascular dementia. Additionally, high blood pressure is closely linked to heart disease, as it can strain the heart and increase the risk of heart attacks, strokes, and other cardiovascular complications. Managing blood pressure effectively is critical to reducing the risk of cognitive decline in heart conditions. By controlling blood pressure through lifestyle modifications, medication, and regular monitoring, individuals can lower their risk of developing dementia and heart-related issues. Maintaining a healthy blood pressure level can help protect the brain and heart from damage caused by hypertension, promoting overall brain and cardiovascular health. Monitoring blood pressure regularly is essential for maintaining optimal brain and heart health. By keeping blood pressure within a healthy range, individuals can reduce the risk of dementia and heart disease, leading to a higher quality of life and improved overall well-being. Understanding the relationship between blood pressure, dementia, and heart disease highlights the importance of proactive blood pressure management in preserving cognitive function and cardiovascular health. Prioritizing blood pressure control can help individuals take proactive steps toward protecting their brain and heart health for years. Secondary hypertension. Secondary hypertension is a less common form of high blood pressure caused by an underlying medical condition. It is essential to differentiate secondary hypertension from primary hypertension, the more prevalent form of high blood pressure with no identifiable cause. Understanding the concept of secondary hypertension and its implications is crucial for correctly diagnosing and treating this condition. Unlike primary hypertension, which is often related to lifestyle factors and genetics, secondary hypertension is caused by an underlying medical issue that affects blood pressure regulation. Medical conditions such as kidney disease, hormonal imbalances, thyroid disorders, and obstructive sleep apnea can contribute to the development of secondary hypertension. Identifying and addressing the root cause of high blood pressure is essential in effectively managing secondary hypertension and reducing the risk of complications. Proper diagnosis and treatment of secondary hypertension are essential for addressing the underlying medical conditions that contribute to elevated blood pressure levels. In many cases, treating the underlying cause of secondary hypertension can significantly improve blood pressure control and overall health outcomes. Healthcare providers may recommend a combination of lifestyle modifications, medication, and targeted therapies to manage secondary hypertension and reduce the risk of associated complications. The implications of secondary hypertension extend beyond elevated blood pressure levels, as untreated underlying medical conditions can lead to serious health issues such as kidney damage, heart disease, and stroke. By recognizing the signs and symptoms of secondary hypertension and seeking timely medical intervention, individuals can take proactive steps toward managing their blood pressure and addressing any related health concerns. Secondary hypertension is a distinct form of high blood pressure that is caused by underlying medical conditions. Proper diagnosis, treatment, and management of secondary hypertension are essential for addressing the root cause of elevated blood pressure levels and reducing the risk of associated health complications. By understanding the concept of secondary hypertension and its implications, individuals can work with their healthcare providers to develop personalized treatment plans that target the underlying medical issues contributing to high blood pressure. Reduce high blood pressure and hypertension. Lowering high blood pressure and managing hypertension is essential for maintaining overall health and reducing the risk of cardiovascular complications. By incorporating practical tips and strategies into your daily routine, you can take proactive steps toward achieving optimal blood pressure levels and improving your well-being. Here are some actionable recommendations to help you reduce high blood pressure and hypertension. 1. Embrace a healthy lifestyle. Regular exercise, such as brisk walking, cycling, or swimming, can help lower blood pressure levels and improve cardiovascular health. Aim for at least 150 minutes of moderate intensity exercise per week to reap the benefits of physical activity. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins while limiting sodium, saturated fats, and added sugars can also support healthy blood pressure levels. 2. Monitor your blood pressure. Regularly checking your blood pressure at home or during routine healthcare visits can help you track changes and make informed decisions about your health. Understanding your blood pressure readings and working with your healthcare provider to set target goals can guide your management of hypertension. 3. Consider medication and medical interventions. Sometimes, lifestyle modifications alone may not control high blood pressure. Your healthcare provider may recommend medication, such as diuretics, beta blockers, ACE inhibitors, or calcium channel blockers, to help lower blood pressure levels. Medical interventions, such as renal denervation or angioplasty, may also be considered for individuals with resistant hypertension or underlying medical conditions. 4. Manage stress and prioritize self-care. Chronic stress can contribute to elevated blood pressure levels, so incorporating stress-reducing activities such as mindfulness, meditation, yoga, or deep breathing exercises into your daily routine can help promote relaxation and lower blood pressure. Prioritizing self-care and finding healthy ways to cope with stress can support your overall well-being and blood pressure management. By implementing these practical tips and strategies, you can empower yourself to take control of your blood pressure levels and work towards achieving optimal cardiovascular health. Making small, sustainable changes to your lifestyle, monitoring your blood pressure regularly, and seeking appropriate medical guidance can help you effectively manage hypertension and reduce the risk of associated complications. Remember that every step you take towards lowering high blood pressure is a positive investment in your long-term health and well-being. Managing blood pressure and hypertension is crucial for maintaining optimal cardiovascular health and reducing the risk of associated complications. Throughout this video, we have explored various aspects of blood pressure management, from understanding the importance of controlling high blood pressure to discussing practical tips and strategies for lowering blood pressure levels. First and foremost, we highlighted the significance of managing blood pressure for overall health. High blood pressure can lead to severe conditions such as heart disease, stroke, and kidney problems, underscoring the importance of keeping blood pressure within a healthy range. By incorporating lifestyle modifications, monitoring blood pressure regularly, and seeking appropriate medical guidance, individuals can take control of their blood pressure levels and improve their quality of life. We also delved into the impact of secondary hypertension, the relationship between blood pressure, dementia, and heart disease, and the most overlooked causes of hypertension. Understanding these concepts can empower individuals to address underlying medical conditions, make informed health decisions, and achieve optimal brain and heart health. As you embark on your journey towards better blood pressure management, we encourage you to prioritize your cardiovascular health by implementing the insights shared in this video. Whether adopting a healthy lifestyle, monitoring your blood pressure, or seeking medical interventions when necessary, every step you take towards lowering high blood pressure is a positive investment in your long-term well-being. To stay informed about the latest developments in blood pressure control and cardiovascular health, we invite you to subscribe to our channel, like this video, and share it with others to spread awareness about the importance of blood pressure management. Together, we can positively impact the health and well-being of individuals worldwide. Thank you for watching, and remember, your heart health matters.